Hi, everyone. I brought back up, and I'll introduce her in just a moment. I'm Joy Roberts. I'm the Dean of the School of Nursing and Health Studies, and we've got a long history of trying new things really early, from starting our nurse practitioner programs, not just in the campus arena, but expanding the programs by broadcast, so it was long ago, it was in the early 90s, to locations, distance locations in rural Missouri, both northwest and southwest Missouri, that allowed us to educate more nurse practitioners who would stay in rural Missouri to practice, to being the first School of Nursing to put their classes online. I did the first one, that was in 1999, and to being the first to open a Doctor of Nursing practice program in the early 2000s. And now we've moved more deeply into research, and our vision for the future of research is to advance our current funded research, our collaborations, and the potential commercialization of our research findings. So I would like to introduce Dr. Mei Fu, our Associate Dean for Research, who is in her second year with us, yes, and we are very glad to have her because she has really lit a fire within our researchers, and she's going to give you a summary of our activities for this year. Dr. Fu?
I'm short, you see that. Yeah. Thank you, Dean Roberts, and thank you. I'm honored to represent Dean Roberts here, and great to see all the deans and all the students, and some of you also ride with me on the campus shuttle bus almost every day, and somebody's waving to me. So today, it's my honor to really show and what we called School of Nursing and Health Studies Research into Entrepreneurship. So basically, nursing and our research is focused on 4 pillars. And this 4 pillars is the first pillar is really advanced nursing education and clinical practice and nursing health workforce. The reason is because in 2020-30, you will see a big shortage of nursing. But if you don't feel the importance of nursing right now, when you're getting older and hospitalized, you know the only person you can trust is nurses. Okay, so that's why we want to make sure and everybody will have the quality care when we need them. And I recently had experiences because I never hospitalized, and my dad was hospitalized, and I realized the only people really taking care of my dad are the nurses, basically. I did not see any of the doctors there, but forget me about that part. The second pillar is really we're focused on, because nurses are really focused on the comfort, right? And what is can we make ourselves comfort? So we're really looking at advanced symptom science and also the chronicness management. And then we are also focused on the improvement for the pediatrics and women and substance use. The fourth pillar is really focused on the communities. How are we going to improve the community in terms of physical activities and nutrition? With these 4 pillars, and we are advance our education, practice, and our research and service. Hopefully I can, okay, good. And you can also see our research not only have 4 pillars, but also all the pillars have a funded research. You can also see we have a federal grant, we have an NIH grant, we have a foundation grant, and we also have an America grant. We have a Department of Transportation. We have a Centers for Disease Control and Prevention. But most importantly, you can see our funders are very variety, and also shows our research focus are also problem solving, like Dr. Novak said. we are the entrepreneurs of nursing, and that's why we really focus on the problems we have. So to resolve the problems of the nursing workforce, and some of faculties, Dr. Alida Skarbeck and Dr. Matthew Chrisman, they are focused on how to decrease the burnout of the nurses, and collaborated with all the hospitals in the Kansas City and Missouri and across the country to really try to understand what are the factors really create the burnout of the nurses, and so that we can return the nurses. And second, we're also looking at technologies. We have a wonderful simulation lab, and we also have what we call escape room, because nursing students, like medical students, and I also think the pharmacy and the dentistry, it's very heavily loaded academically, a lot of distress, a lot of anxiety. So they're really looking at escape room, how the escape room, like let people just have a few minutes of relax, few minutes of the breathing, and can help the students to decrease their decrease their distress and help them to coping better. But thinking about the next gen, looking at how that escape room will change the gene expressions or biomarkers, and that's something, if somebody's interested, and we have expert here. And second is really like the big pillars we have is advanced symptom science and manage the chronic illness. And we have a worldwide renowned expert in the kidney transplantations, Dr. Cindy Russell, who was supported multiple times by NIH, and she's still doing a lot of research. So currently, she is trying to collaborating with engineer scientists to really looking at pictures of the peritoneal dialysis patient, how to help them to identify infections quicker, and also hopefully can use machine learning to really identify those risks quickly. And we also have a Dr. Sue Lasseter, also a nationally well-known scientist on the dementia and also cognitive impairment in the critically ill patient. So many critically ill patients, when they are hospitalized in the ICU, and you started to see their decline of cognition, right? But many of them never recovered. So Dr. Lasseter's studies really looking at how that experience in the ICU impact people's cognitions, and how are we going to reverse that cognition impairment. And next one is me. So my research is really focused on symptom management and also precision health from the nursing perspectives. So I have done a lot with the pain, lymphedema, and currently I have a funded research really looking at AI-assisted pain management and chronic pain management, and also with NIH support, I developed machine learning for AI-assisted lymphedema diagnosis. If you all understand lymphatic system, that is the only system that we haven't really fully understand it. And if you're thinking about the next gen, the personalized intervention, and the lymphatic system has been really related to heart failure and cancer patients, lymphedema, and also with obesity patients, a lot of things. So if you're interested in collaborating, and I'm very open with it. And we also have one EIG grant, an Entrepreneur Innovation Grant, really try to commercialize our AI-assisted products here. And the third pillar is really looking advance the health with women and substance use. So we have a Dr. Sarah Patel, who is specifically interested in pelvic pain in women, because the pelvic pain in women, it takes the woman years to be diagnosed. And you have to go to multiple CT scans, multiple ultrasounds in order to get a definitive diagnosis. So what she's really looking at how the pelvic congestions, that is the fluid accumulation caused by venous return and caused by the lymphatic system, and to really use bioimpedance to really see if we can diagnose women with pelvic pain much better. And with that, and she might be able to go with the AI to really thinking about how the bioimpedance will be able to help with the diagnosis. And we also have Dr. Kristen Wilson really looking at the sexual and reproductive health. And we also have a RO1, Dr. Rhiannon Anderson right now, really looking at the sexual violence. You know, how are we going to help people who have such experiences and also prevent the sexual violence? And we also have a Dr. Lisa Carter, who is having a founded research with the substance use and addiction. And as we really, School of Nursing and Health Studies really helping with the communities surrounding us here. So many of our studies really focus on how to increase physical activities in the communities. And this is represented by Dr. Amanda Grimes and Dr. Matthew Chrisman and Dr. Joseph Lightness. And then right now, they're really looking at not only just like a communities within, truest area. Right now, they're also looking at the whole Kansas City. And we also have Dr. Matthew Chrisman and also Dr. Kelsey Gardinas really looking at the food insecurity and the nutrition. And they basically have studies right now to give people fresh produce for 12 weeks and also help them to get different recipes, and they're looking at their hemoglobin A1C, their obesity level, but I was also thinking about just by trying to help people to eating healthy, that will also help with the gene expressions. So basically, they can also looking at inflammatory genes expressions later on. So if some of you want to collaborate with them, they already have a cohort of patients, and that will be something you can looking at it. And we also have focus just on the chronic pain for community dwelling patients. And so I have a studies right now in New Jersey and really looking at how to help patients to manage the pain because of the obesity. And also Dr. Amanda Grimes also used the same assessment in her studies right now to really say what are the pain prevalences in Kansas City, because the studies I did in New Jersey is 87% underserved communities, people experience chronic pain. Finally, it's the same thing with the food, nutrition, and securities. We also have studies and which supported by AmeriCorps, led by Dr. Sharon White Lewis, really looking at how to prepare elder peoples in the community to cope with emergencies. And her studies basically go to door by door to train the elders and how their balances. So when the emergency comes, and they can really deal with the emergency. And with Kansas City, and we also have a wonderful studies by Dr. Amanda Grimes and Dr. Joseph Lightner to really what we call the zero fail. Basically, they give bikes to people, or they give vouchers to people without payment for the buses and also riding the bicycles, and see how are they going to improve the transportations within the city, So those are the things our faculties actually funded are doing, and also are really looking at the real world problems, and we try to find solutions for it. And I have to say we are very proud of our faculties, because if we are going to list our collaborations nationally, internationally, I probably will not have this like beyond the slides, beyond. But I want to see we collaborate with everybody within the UMKC, and also we collaborate with MU, but we also want to collaborate with Lex Gym, because I think there's a lot of what we do if with your expertise, and we can definitely looking at, for example, how are we going to looking at inflammatory genes related to pain, and if we have food like nutrition, lymphatic augmentation, and how that will change the biomarker expressions, right? And that all of this will be very helpful. So if you are interested in collaborating with us, and we will, Dean Roberts will be happy to host a meeting, and I will be happy to connect with you and with our researchers. But thank you again very much. And as nurses, we are really looking at the real world problems. You can see that. Thank you.